Joining us next is former U.S. Secretary of Health and Human Services, Kathleen Sebelius. Secretary, it's nice to see you. I don't believe we've spoken since the last time you were in office. I want to ask you about the other big factor. We're just talking about food and SNAP benefits, but the other thing that's already stressed out American families is open enrollment for the Affordable Care Act kicks in today for millions of recipients who are now facing the largest increase in costs since that law went into effect over a decade ago. What price hikes can enrollees, myself included, expect to see, and what is driving this spike?
Well, Christina, I think what we're seeing is the Republicans once again doing what they have done since the beginning of the Affordable Care Act, which passed in 2010. So the Republicans shut the government down in 2013 in October, so people would not be able to enroll in the Affordable Care Act, trying to stop the Affordable Care Act. And that shutdown was eventually resolved, and indeed the act got up and running. They tried again in the first Trump administration to repeal the law. And then famously, John McCain, former Senator John McCain, went to the floor of the Senate and voted no to repeal, and that effort went by the board. So here we have Republicans once again shutting the government down because they do not want to give the tax benefits that people have relied on to buy their own health insurance. Every kind of health insurance delivered in this country is subsidized by the federal government. If you work for a big employer, your employer gets tax benefits for offering that health insurance. Medicaid is entirely a state federal partnership where people pay some premiums. The marketplaces, people are paying for their own coverage and they're getting some tax benefits. Medicare, about 75% of the Medicare benefits for outpatient care and drugs are paid for by the federal government. So this is not an unusual thing. The Republicans, once again, are forcing people to make very tough choices. I think today the marketplace, healthcare.gov, is open and people can do early shopping, if you will. Look at what the benefits they're going to get and what premiums they'll pay in starting in January. But I think they're going to be shocked. A lot of places, people will see their exact same plans double in cost from what they paid last year, or be 30 or 40 or 50% higher. It's going to be a dramatic change for lots and lots of folks. And many people will just decide, unfortunately, that they can't any longer afford health care for themselves and their families, that they're going to take a huge risk and hope that something tragic doesn't happen. Christina, the other thing that the Trump administration and this Congress has already done is to dramatically cut back on open enrollment, so a shorter period of time. And this time that there's a lot of churn and people are going to need more information, they're going to have less time to make choices. They've got to sign up between now and the middle of December, so in the middle of holiday season. And there are far fewer people, thanks to the big bill that Congress passed. They've cut way back on navigation services. So there are fewer people in your hometown to talk to about what your plan could look like. So it's becoming much tougher for much more expensive rates.
It's really confusing. It's really overwhelming. And for a lot of Americans, other than rent or the place that you live, it's their biggest single expense on a monthly basis. In 2025 alone, about 22 of the 24 million Americans with a health plan from the ACA marketplace received a premium tax credit. So what do you think is going to happen if what you were just talking about does happen? People go on, they log on, they look at those prices and say, I just can't afford this. I'm just going to roll the dice and not get health insurance. It's bad enough on an individual basis, but can you explain what that does to the system? Because the fewer people that are in it, that's a bad thing for everybody, right?
Well, it's a really bad thing for everybody because there is nothing in the law that requires insurance companies to sell insurance. So one thing that can happen is a bunch of companies just drop out of the marketplace and say, we can't do this anymore. The other thing that happens is for those people who are have a pre-existing condition, have somebody with special needs, desperately need health insurance, they stay in the market. But the younger and healthier folks drop out because they say, I got to pay rent, I got to buy groceries, I now don't know if I'm going to have SNAP benefits, I'm going to let my health insurance go. So they drop out, which raises rates for everybody else. It puts hospitals in jeopardy to have fewer people insured. They have people still coming through the emergency room, coming to them in sicker shape and without insurance coverage. Doctors don't get paid for their services if they see folks. So it has a spiral effect where the insurance marketplaces, which now include 20 million people, some of them sicker than others, it's a kind of healthy pool, they become really what's called a high-risk plan, where only older, sicker, more consumers who need desperately health insurance and use it on a regular basis, the more expensive customers stay in the market, and everybody else rolls the dice. Medical bankruptcies go up, and providers are in really bad shape. So it's not good.
Yeah, but I'm sorry, before I let you go, because we are running out of time, I want to ask you about SNAP. At what point does that reach a crisis, or do you think we're already there? And, the judge has ordered the government to pay. Is that going to happen? How soon can these families start to see these benefits resume? Will they?
Well, we're in a crisis right now. Again, the bill that was passed earlier by Congress, the budget bill that was passed, slashed support to food banks across this country. So you already saw higher demand and food banks with a lot less supply to give out to people. Now, we have over 40 million people who rely on SNAP benefits. 4 out of every 5 households has a disabled person, has a child, has a senior in that household. So this is a crisis. And we found money to do a $40 billion bailout for Argentina. They're finding money to put gold every place and build a giant ballroom. There are supplemental funds that Congress set aside to make sure this couldn't happen, that we feed people in America. Congress has to step up and demand that these money be used immediately.
All right. Secretary Sebelius, thank you so much for joining us.